We have 56-year-old man with acute back pain. We have MRI of the lumbosacral spine. We have sagittal T1, sagittal T2 and stir sequences and axial T2 sequences. What we have got is abnormality as L5 S1 disc level. Let's forget about other abnormalities in the rest of the spine. Let's concentrate only on this. On the sagittal T1, there is complete destruction of the S1 and the L5 vertebral bodies with loss of demarcation of the end plates with the L5S1 disc. There is prevertebral soft tissue abnormality and also there is some epidural abnormality. The destructive abnormal signal is extending into the pedicles bilaterally at both L5 and S1. The prevertebral swelling is extending beyond the vertebral margins. On the sagittal T2 and stir sequences, what we see is L5S1 disc is showing significant increased signal compared to the rest of the discs, and the rest of the destructive process is showing heterogeneous increased signal intensity on both T2 and stir sequences. The additional findings what we see on the axial is there is epidural soft tissue abnormality which is causing significant compromise of the thecal sac and also causing significant impingement on both traversing S1 nerves. On the sagittal T1 sequence, the exit foramina and the exiting nerves are not seen at the level of L5 S1 and S1 which is suggestive of impingement on the exiting L5 and exiting S1 nerves bilaterally. The important negative findings to comment in the report is there any epidural abscess within the limitations of no intravenous contrast? There is none. Is there any prevertebral or paravertebral abscess or collection? There is none. Is there any lymphadenopathy in the para-aortic region? Is there any abnormality in the visualized portions of kidneys? There is none. So based on these findings, features are highly suspicious for bacterial spondylodiscitis. Differential would include tuberculosis, but given the acute onset, this is unlikely. But we should always keep tuberculosis in differential. Post-contrast study would be useful to look for is there any epidural abscess and also would be very useful in follow-up scans.